Today, we're diving into a quiet revolution that's happening in, well, probably the most chaotic room in any hospital, the emergency room. And it's a revolution that's being powered by two things: artificial intelligence and a tiny pocket-sized window into the human body. Okay, let's get into it.
Just think about this for a second. What if a doctor could look at a patient and see not just what's happening right now, but what's about to happen in 2, 4, even 6 hours? What if they could actually predict a life-threatening crisis long before the usual warning signs even show up? This isn't science fiction anymore. It's the new frontier of emergency medicine.
To really get why this is such a game changer, you have to understand the ER. It's just a constant race against the clock. It's a world of, organized chaos, where every single second counts, and doctors have to make huge decisions with just fragments of information.
The data just comes flying in. A patient is rolled in, their heart rate is through the roof.
A moment later, a nurse calls out new vitals. Their blood pressure is starting to drop. You can see the body is beginning to fail.
And here is the fundamental problem. You see all the signs of a storm coming, but you have no idea what's causing it. Is it a massive infection? Some kind of internal bleeding? A heart problem? The doctor has to act right now, based on their best guess, with a totally incomplete picture.
But what if we could complete that picture instantly? This is where a whole new approach comes into play, one that connects the raw power of computation directly to the patient's bedside and gives doctors a brand new toolkit.
And this brings us to this idea called bench to bedside. So on one side, you have the bench. That's all the incredible heavy-duty data analysis, AI models, and pure computational power. On the other side, you've got the bedside. That's the real world with the patient, the doctor, and their clinical judgment. The big idea here is to bridge that gap, to bring the power of the bench right to the bedside to solve these critical problems. So how do they actually do it?
Well, the first tool is called POCUS, which stands for Point of Care Ultrasound. Honestly, the best way to think of it is like a doctor's medical flashlight. It's this little handheld device that lets them see inside the body, the heart, the lungs, the major blood vessels, all in real time without the patient ever having to leave the room. It's literally a pocket-sized window into what's going on inside. The second tool is the brain of the operation, artificial intelligence. We're talking about algorithms that have been trained on millions, and I mean millions, of data points. Ultrasound images, vital signs, ECGs, you name it. They're built specifically to see complex patterns that are often completely invisible to the human eye. So the AI basically becomes the doctor's pattern-detecting partner, an instant expert that can process a staggering amount of info in seconds.
Okay, so let's look at the first incredible thing you can do with this toolkit. How do you use these tools to predict a crisis that, well, hasn't even fully happened yet?
Let's talk about shock, and not the emotional kind. We're talking about circulatory shock, which is when the body's organs just aren't getting enough blood to survive. The most dangerous version is called cryptic shock. That's where a patient is crashing on the inside, but their vital signs on the monitor still look deceptively stable. It is a silent killer.
This is where that bench-to-bedside workflow is so powerful. Step 1, the doctor collects a bunch of data right there from the patient. They use the POCUS to scan the heart and vessels, they grab an ECG, and they record the vitals. Step 2, all of that different data gets fed directly into the AI model. Step 3, the AI crunches all the patterns and generates a risk score, predicting how likely it is that this patient will go into full-blown shock within the next 6 hours. And Step 4, the patient's outcome actually validates the prediction, proving the model saw the crisis coming hours before anyone else could have.
So that's how this toolkit can kind of predict the future. But it's also being used to solve really complex medical mysteries in the present, especially when different diseases show up looking exactly the same.
So here's a classic ER dilemma. A 75-year-old patient comes in and they're struggling to breathe. Is it acute heart failure, a really bad COPD flare-up, or a life-threatening blood clot in the lungs, a pulmonary embolism? At first glance, they can all look identical. The problem is the treatments are completely different, and making the wrong choice here could be fatal.
So the doctor does a quick series of POCUS scans, and the AI gets to work, analyzing the images for very specific patterns. For heart failure, for example, it might see that the heart isn't pumping well, the main vein is swollen, and there are these things called B lines in the lungs that signal fluid. But for a COPD flare-up, those same things usually look pretty normal. For a pulmonary embolism, it might spot strain on the right side of the heart. The AI has been trained to see the unique fingerprint of each disease.
And this is what the doctor sees. It's not just one single answer.
The AI gives them a probabilistic diagnosis. So in this case, it's saying there's an 85% probability that this is heart failure. Now, this doesn't replace the doctor's decision, but it gives them an unbelievably accurate, data-driven place to start, pointing them toward the right treatment right away.
And this exact same approach is starting to revolutionize how they handle chest pain by combining everything: the patient's story, an AI-powered analysis of the ECG that can spot things a human might miss, and those targeted POCUS heart scans. The model can generate a really precise risk score. This is huge because it helps doctors more safely make that critical call: who can go home and who needs to be admitted for urgent care right now.
So what does all this mean for the future? I mean, are we talking about a world run by medical robots? No, not at all. We're talking about the rise of something much more interesting: the augmented doctor.
This quote from the research really just nails the whole idea. The AI isn't the one in charge. It's like a new partner in the room. It's an instant, always-on, expert second opinion that has seen millions of cases to help inform the one happening right in front of you.
And that is the absolute key takeaway. The doctor, with all their years of training, their intuition, their empathy, they are still at the very center of patient care. This technology is just supercharging their abilities, letting them see more, know more, and act faster than ever before. It's all about enhancing human judgment with the incredible power of data.
So this leaves us with a really fascinating question to think about. As this kind of technology becomes more and more common, it's going to fundamentally change how medicine is practiced. So, when your doctor's most trusted partner is an AI, what does the future of care really look like?